Schizophrenia is a severe and chronic mental disorder that affects a person's thoughts, feelings, and behavior. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for them and for their family and friends. It is a complex condition characterized by a range of symptoms that can significantly impact an individual's ability to function in daily life. Contrary to popular misconceptions, schizophrenia is not synonymous with a split personality. The key features of schizophrenia include disturbances in thinking, emotional regulation, and behavior. The onset of schizophrenia typically occurs in late adolescence or early adulthood, and its course can be chronic or episodic. The exact causes of schizophrenia are not fully understood, and the development of the disorder is likely influenced by a combination of genetic, biological, and environmental factors. Research in this area is ongoing, and while there is no single definitive cause, several contributing factors have been identified. First is genetic factors. Family history. Individuals with a first-degree relative, parent or sibling, who has schizophrenia have a higher risk of developing the disorder. However, the majority of individuals with schizophrenia do not have a family history of the condition. Genetic predisposition. Certain genetic factors appear to contribute to the susceptibility to schizophrenia. Multiple genes are likely involved, each with a small effect. Second is biological factors. Neurochemical imbalances. Dysregulation of neurotransmitters, particularly dopamine, is thought to play a role in the development of schizophrenia. Antipsychotic medications, which are often used to treat the disorder, work by modulating dopamine levels in the brain. Brain structure and function. Structural and functional abnormalities in the brain, including changes in the size of certain brain regions and altered connectivity, have been observed in individuals with schizophrenia. These abnormalities may be present before the onset of symptoms. Prenatal factors. Exposure to certain factors during prenatal development, such as malnutrition, viral infections, or stress, may contribute to an increased risk of developing schizophrenia later in life. Third is environmental factors. Psychosocial stressor. High levels of stress, trauma, or adverse life events during childhood or adolescence may contribute to the onset of schizophrenia in vulnerable individuals. Drug use. The use of psychoactive substances, particularly cannabis, during adolescence has been associated with an increased risk of developing schizophrenia. Substance abuse can also exacerbate symptoms in individuals who already have the disorder. Urban living. Some studies suggest that growing up in an urban environment may be associated with a higher risk of developing schizophrenia. The reasons for this association are not fully understood and may involve a combination of social and environmental factors. Schizophrenia is characterized by a range of symptoms that can be broadly categorized into positive, negative, and cognitive symptoms. Here's an overview of each category. First is positive symptoms. Hallucinations. Perceptions that occur without external stimuli. The most common type is auditory hallucinations, where individuals hear voices that others do not. These voices can be critical, commanding, or conversational. Delusions. Strongly held false beliefs that are resistant to reasoning or contrary evidence. Delusions can take various forms, such as paranoid delusions, believing others are plotting against them, or grandiose delusions, having an inflated sense of self-importance. Disorganized thinking. Difficulty organizing thoughts, leading to speech that may be incoherent or illogical. This can manifest as tangential or loose associations, making it challenging for others to follow the person's train of thought. Movement disorders. Agitated or repetitive movements, catatonia, immobility and unresponsiveness, or excessive motor activity. Second is negative symptoms. Flat affect. Reduced emotional expressiveness, including facial expressions, voice tone, and gestures. Individuals may appear emotionally unresponsive or have a limited range of emotional expression. Social withdrawal. Difficulty initiating and maintaining relationships. Individuals may isolate themselves and avoid social interactions. Anhedonia. Diminished ability to experience pleasure or interest in activities that were once enjoyable. Cognitive impairment. Difficulty with attention, memory, and executive functions, impacting problem-solving and decision-making. Third is cognitive symptoms. Impaired memory. Difficulty in retaining and recalling information. Executive dysfunction. Challenges in planning, organizing, initiating, and completing tasks. This can affect an individual's ability to manage daily activities. Attention difficulties. Difficulty concentrating and sustaining attention on specific tasks. It's important to recognize that the severity and combination of symptoms can vary, and individuals may experience periods of exacerbation, acute episodes, and periods of remission. The impact of schizophrenia extends beyond the individual to family members, friends, and the broader community. Here are some of the effects associated with schizophrenia. Social and occupational dysfunction. Individuals with schizophrenia may experience difficulties in forming and maintaining relationships. Social withdrawal, communication challenges, and the stigma associated with mental illness can contribute to strained interpersonal connections. Many individuals with schizophrenia find it challenging to maintain employment or pursue educational goals. Educational challenges. The onset of schizophrenia often occurs during late adolescence or early adulthood, a critical period for education and career development. Academic performance may be affected, potentially leading to disruptions in educational attainment. Health and self-care. Individuals with schizophrenia may face challenges in maintaining overall health. Factors such as medication side effects, lifestyle factors, and difficulty accessing healthcare services can contribute to physical health issues. Basic self-care activities, such as personal hygiene, nutrition, and managing daily routines, may be compromised. Stigma and discrimination. The stigma associated with mental illness, including schizophrenia, can lead to discrimination, prejudice, and social exclusion. Individuals with schizophrenia may internalize societal stereotypes, leading to lowered self-esteem and diminished self-efficacy. Financial challenges. Difficulties in maintaining employment can lead to financial instability. Unemployment rates are higher among individuals with schizophrenia compared to the general population. Caregiver burden. The caregiving role for family members of individuals with schizophrenia can be emotionally and physically demanding. Balancing support, understanding, and the need for boundaries is a constant challenge. The costs associated with treatment, medications, and support services can contribute to financial strain for both individuals with schizophrenia and their families. Recovery from schizophrenia is a complex and ongoing process that involves a combination of medical, psychological, social, and rehabilitative interventions. While schizophrenia is a chronic condition, many individuals can lead fulfilling lives with the right treatment and support. Here are key aspects of recovery and treatment for schizophrenia. First is medication. Antipsychotic medications are the primary treatment for managing the symptoms of schizophrenia. They work by affecting neurotransmitters, particularly dopamine, in the brain. Antipsychotic medications may have side effects, including weight gain, sedation, and metabolic changes. Monitoring and managing these side effects, in collaboration with a healthcare provider, are essential for treatment adherence. Second is psychotherapy. Cognitive behavioral therapy can help individuals with schizophrenia manage symptoms, improve coping skills, and address distorted thought patterns. It is often used in combination with medication as part of a comprehensive treatment plan. Involving family members in therapy can enhance communication, improve understanding, and provide support for both individuals with schizophrenia and their families. Third is community support. Community-based programs, day programs, supported employment, and social skills training can help individuals with schizophrenia develop and maintain important life skills, fostering independence and integration into the community. Having a case manager or mental health professional to coordinate care and support can be crucial in ensuring individuals receive the necessary services, including housing, employment assistance, and social support. Fourth is education and coping skills. Providing individuals and their families with information about schizophrenia, treatment options, and strategies for managing symptoms can empower them to actively participate in the recovery process. Learning effective coping mechanisms can help individuals navigate challenges and stressor associated with daily life, reducing the impact of symptoms. Fifth is peer support. Engaging with peers who have experienced similar challenges can provide valuable insights, encouragement, and a sense of community. Peer support groups can be a source of understanding and connection. Sixth is early intervention. Early diagnosis and intervention can significantly improve outcomes for individuals with schizophrenia. Timely access to appropriate treatment and support services is crucial for managing symptoms and preventing long-term disability. Seventh is holistic approach. Addressing physical health through regular exercise, a balanced diet, and routine medical checkups is essential. Physical well-being contributes to overall mental health and can help mitigate some medication side effects. Addressing substance abuse issues is important, as substance use can exacerbate symptoms and interfere with the effectiveness of treatment. Eighth is goal setting and rehabilitation. Vocational rehabilitation and supported employment programs can help individuals with schizophrenia develop job skills and re-enter the workforce. Setting and achieving realistic goals, whether related to employment, education, or personal life, can contribute to a sense of purpose and accomplishment. Recovery from schizophrenia is a unique journey for each individual, and the emphasis is on improving overall quality of life. If you found this video helpful, then please share it with others.